Welcome, I'm Glen Anderson, producer and host of this TV series, Glen's Parallax Perspectives. This series explores a wide variety of issues related to peace, social and economic justice, the environment, and nonviolent social change. We especially provide opportunities for the public to hear voices and viewpoints that are rarely heard in mainstream media. Mainstream media, politicians, and culture see the world in conventional ways. The establishment is stuck in how they see the world. In order to solve problems, we need to see things differently. This TV series, Glen's Parallax Perspectives, can help us see things differently so we can solve problems at all levels, from the local to the global. This series is called Glen's Parallax Perspectives. Here's what the word parallax means. Put one finger in front of your nose and another finger farther away. Close one eye, then open that eye and close the other. Your fingers will seem to move. This is called a parallax view. This TV series invites you to look at issues from fresh perspectives. Also, see much information about the issues that we cover in this TV series and previous episodes of this series at my blog, www.parallaxperspectives.org. And now I invite you to watch this month's program.
This month's interview on Glen's Parallax Perspectives examines our nation's chronic failure to provide health care for everybody, and chronic failure to control costs, and chronic injustices in paying the bills. The U.S. spends twice as much per capita than other nations do, but many millions of Americans have no health care at all, and other nations' people are much healthier than Americans are. Two guests will explain the problems in clear and understandable ways, and they will propose a smart, cost-effective way to cover everybody with high-quality health care at lower cost than we pay now. Obama's Affordable Care Act, the ACA, that some people call Obamacare, but it's the ACA, is far less than what we need. It fails to cover everyone, fails to provide high quality, fails to control costs, and fails to efficiently manage how to pay the bills. We can do much better than that. It's a step in the right direction, but universal single payer is really the healthcare solution that our nation needs, and we will explain why. By the end of this hour, you will really be connected with that smart concept. One of our guests, Lynnette Vehrs, is a registered nurse from Spokane, and the other guest, Sarah Weinberg, is a medical doctor from the Seattle area. Both are active in a statewide organization that is working for universal single-payer healthcare, and this organization is called Healthcare for All Washington. I'm happy to welcome both guests, Lynnette and Dr. Weinberg. Lynnette Vehrs, MN, RN, is president of the Washington State Nurses Association. She is a member of an excellent nonprofit organization, Healthcare for All Washington, that works for universal single payer at the state level here in Washington. Lynnette, good to have you here.
Thank you.
And Dr. Sarah K. Weinberg, MD, is a longtime leader of Healthcare for All Washington. She's a member of their board and currently edits the newsletter, which is fascinating and informative. So I enjoy reading it the very day that it arrives. I'm on it right away. So thank you for that. And Dr. Weinberg used to be the organization's vice president. She's also president of the Western Washington chapter of Physicians for a National Health Program, PNHP. And in the December 2015 program I did on this topic, she was my only guest, and we really made a solid case. And now I'm happy to have you back again, Dr. Weinberg.
Thank you.
Thanks. Okay, well, we'll have a good time. We have information from each of them. And I want to start with Dr. Weinberg and say, what problems in our nation's healthcare system have been lasting a long time? What are the chronic problems in this non-system that we have?
I would say the worst problem is unaffordability, that we've allowed costs to go through the roof. That shuts a lot of people out because they can't afford to pay for care that they should have. As a result, our system does not cover everybody. There are a lot of people who are just feel excluded and don't dare seek medical care until they're desperate or dying.
Yeah, and we're seeing this even now during the coronavirus pandemic, where
Yes.
people who might have some symptoms don't want to go because they're afraid they might not be able to pay for what the answer turns out to be.
Exactly.
So, and we'll cover some more about this later. Lynnette, could you add anything to the long-standing problems in our nation's healthcare?
Yeah, and I think something that we'll be talking about also this evening is access. People don't have access to healthcare, and much for what Sherry had said, and that is they're overwhelmed with the cost. They don't trust the system, and they're concerned they might get a bill that they can't pay.
Yeah, there are lots of related problems, and these will come out as we dig deeper into the issue and as we look at remedies that will solve problems. I want to ask Dr. Weinberg again, in what ways does the Affordable Care Act, the ACA, that some people call Obamacare, fall short of what we need? And we covered this some in the program we did 5 years ago, but in case people watching now don't remember everything that you said 5 years ago, we should probably catch some of these things, because it really does have some serious shortcomings.
It tried to require everybody to become insured, to buy insurance, but they did not deal well enough with the cost problems. So you still have, it's up to about 30 million now, people who can't afford to buy insurance.
Yeah, and it also did not really deal with quality in ways that we need. And it also kind of reinforced the power that privately owned insurance companies have over our whole healthcare system, and also the privately owned pharmaceutical companies and the for-profit hospitals. It locked them into place as having just controlling power.
Right, and as a result, 10 years after Obamacare started, there's been more consolidation and more monopolies than ever in the medical industrial complex, which a term that we didn't even use. Well, it was first coined in 1980, but it's much more obvious now, with enormous groups buying up hospitals and doctors and everybody else.
Right. And a lot of the money that we spend now, and you gave me the figure of over $3 trillion per year, goes into overhead, and it's the inefficiency of. So if I'm a doctor that has a practice, I've got to deal with maybe a dozen or more insurance companies. They all have their own forms, exclusions, whatever. So I got to hire a lot of employees just to deal with the billing, and that's redundancy, that's waste. And as a doctor, I would have to spend a lot of time arguing with insurance companies that don't want to pay, and when they should be free to actually practice medicine.
Well, you have to hire people to do that work for you. I had a small private practice. I've been retired now for 17 years, so this is old news. But I had to pay 8% of my gross receipts to the billing company.
Yeah, so that's money that goes for overhead when, like, Medicare gets by with just like 2 or 3%, because it's a streamlined system.
Right.
I also want to just mention again that Dr. Weinberg was the guest on my December 2015 program, and at the end of this interview, I'll provide the link for how you can watch that. It was very informative, and we'll go much more into depth than we have time for right now because we got other things we want to talk about. We're covering only some of that information and exploring new territory, and then we have another real live person from Spokane, Lynnette, who has her own insights and experiences. I want to check with you, Lynnette, because this problem of the health system or non-system affects real live people, and you met some through your work recently, and real live people that we know and real life people that the folks watching this TV program know, perhaps people in your family or your network of close friends, have had bad experience with our dysfunctional healthcare system, including the ACA. And Lynnette, you ran for state legislature, state representative in 2016, and you did a lot of doorbelling, as a good candidate would. And some people that you met told you stories about their healthcare problems. Can you share something, without mentioning anybody's name, of course? What kinds of things are you hearing from ordinary people in the Spokane area?
Yeah, I think that's where I got my best stories, was knocking on doors. The first thing I say, hi, my name's Lynnette Vehrs. I'm a registered nurse and I'm running for office. And oftentimes I get, oh, honey, you're a nurse. Why are you doing that? And I go, because I'm a nurse, we need different health care. This isn't working. So this one lady, she was the daughter of the woman that actually I was looking to speak with. And she was probably in her mid-50s. And she had a real heartbreaking story. She goes, let me tell you my situation. I had a brother who had really bad abdominal pain, and he put up with it for quite a while. And she goes, and finally, one time he gave me a call just late in the evening and telling me his pain is too much. He needs to get to the emergency room, and asked her to help him. So she got him into the emergency room. They did all sorts of tests. And the physician said, you need to get a referral to a cancer doctor, an oncologist. So right then and there, they even got him the referral within just days. And so they, of course, gave him pain medication before he left. And she goes, he went to the doctor, but you know what? The doctor said, oh, no, you have cancer. You have it real bad, but you need to get insurance. When you get insurance, then you can come back to me. He died 4 weeks later, no insurance.
Yeah.
And that is just, and that happens every day here in the United States. Hundreds of people die because they either do not have insurance or not adequate insurance.
Yeah, and in other countries, people just can't imagine a country as rich as the U.S. that allows that to happen, because in other countries, if you're in that country, you have the coverage.
Right.
And this happened even within my own family. I have a cousin whose son, Jonathan, died because he had a health problem that required some expensive medication. And he and a lot of his coworkers got laid off from their job and lost their health coverage. And while Jonathan was unemployed, his prescription ran out. He could not afford to refill it. And he found another job, because our whole family is very hardworking people, and he found another job. But his prescription ran out, and 2 days before his job was going to start on Monday, he died on that Saturday. And no other nation, no other modern civilized nation would allow that to happen. You also had a client that had diabetes with sores on her feet. Can you tell us about that?
Yes, for about 18 years, I was a visiting nurse, and here in Spokane. And I really enjoyed that job. It gave me a chance to get to know my clients real well. And this one particular one, I'll call her Margaret. And Margaret was just a hoot. She was so much fun. And she had real brittle diabetes. She had type 1, so she had diabetes as a child. And she still had it. And her husband had passed away a few years back. And she had a sore on her heel. Now, as you know, with diabetics, when you get sores on your feet, they take a long time to heal up. So we were out there doing dressing changes every day. She was very compliant. She was an absolute delight to visit. And then all of a sudden, her insurance company, after about 6 months, and we would measure the wound and make sure it's not getting infected, said, no, we're not going to keep pouring money into this. You're going to have 3 more visits, teach her how to do her own care, or have her teach a neighbor or a family or someone, but we're done. Well, I went back to Margaret then the next day, told her this, and she says, well, I don't have a husband. The neighbors are not real crazy about me, and I have no other family. And she goes, but come on, Lynnette, I can do this. Let's get, I've seen you do this so many times. So she did the best she could. And I knew it probably wasn't going to go great. Well, about 6 months later, I was out taking care of another client, and I got a phone call from my office that said, oh, Lynnette, we have a discharge out of one of the hospitals, and you need to go up there and get the paperwork and see what they need. And it was Margaret. Margaret was coming out of the hospital because they had to amputate the leg. And it didn't have to be that way. So that meant more people were coming into her house, besides a nurse, because she didn't heal well. The stump didn't heal well. She needed physical therapy because now she has a prosthetic leg and she needs to learn how to get around with that. And so the outcome was disastrous, though she still had her great personality.
Yeah. Dr. Weinberg, you know somebody who's close to your family who is turning 26 soon.
That's
and will
right.
be aging out of this person's family, her parents' plan.
Right. One of the things that I think is part of the Affordable Care Act is allowing her to remain on her parents' insurance through age 25, although they have to pay whatever the premium is for that. But she's about to turn 26. She has part-time employment. She's going to school, hopes to go to veterinary school in a year. And she's got to go hunting for insurance. So she, being a young person, started on the computer and went on the internet and looked at this and that, and just the complications of trying to figure out how much, what is her earnings, how much, what should she sign up for, what are the different plans. It just boggled her. Yeah. As far as I know, she hasn't yet really come to grips with it, although I have given her a good reference of somebody to talk to who knows the scoop and can help her navigate it without charging her for it.
Yeah. Now, imagine if somebody is not as smart as this person who's close to your family,
right?
Has difficulty reading or understanding things, has difficulty with the English language, whatever. I mean, there are a lot of people who are just elbowed out of getting access to anything. And again, in a foreign country, people could not imagine such a crazy thing out of this rich nation of ours.
No.
It would never happen there.
I know another youngish man, well, I think he's probably in his 30s or so, lives on Orcas Island in the San Juans, and he doesn't buy insurance because it would have such a high deductible that he can't afford to use it, so why pay the premiums?
Yeah. And I know, yeah, and I know that you have a story about somebody else we don't have time to get into because we got the next question ready to go, but there's somebody else that Dr. Weinberg knows who has really, really excellent insurance, but has encountered enormous problems about billing, trying to get the insurance to actually pay for the stuff that they're supposed to be paying for.
I was really surprised at how hard it is to make sense out of all the bills that come. I've been asked to help sort it out, and okay, Dr. Weinberg, you've got to be the expert.
Yeah. So, and again, imagine if you were somebody that was not as well educated in this subject matter. Now, this program topic about the healthcare, fixing our healthcare system, people nowadays are recognizing especially how broken it is because we have this coronavirus pandemic where millions of people who thought they had healthcare all of a sudden got laid off from their jobs, now they don't. And people are discovering health problems that they had not anticipated. And so it made long-standing problems in our nation's healthcare system even worse. And then without people having any longer any access to the healthcare that they had been having, more people are having healthcare crises. So I want to ask Lynnette if you could discuss how universal single payer, what the concept is, just briefly, because we'll get into it in more detail later, but just the concept of universal single payer and why that's more timely now during the coronavirus pandemic.
Yeah, well, a lot of us trying to make it short and sweet say it's like being 65 and having Medicare, meaning, yes, you still pay something, but you get covered. And so that is a really big thing. So now we've got better access. You will get coverage for your different procedures. You can go to any hospital, any physician that you want. So the choice is huge. I remember in the 1990s, they brought out an advertisement. I think it was the insurance industry, trying to discourage people from wanting to have the Clinton program. And they knew the writing on the wall. The insurance companies aren't going to make any money if something like that were to pass. So I know in the state of Washington, we had some that also came out in the 1990s. And they had also brought around nurses, doctors, physical therapists, and insurance companies. And the insurance companies said, oh, wait, no, we can take care of the cost. We can keep our costs down. They didn't do that, did they?
Yeah. And so the idea is that instead of having privately owned insurance companies, you'd have an efficient system where there's one entity connected with the government that pays, and you don't have a dozen different insurance companies with their own different rules, exclusions, and forms and whatever. And you know that you're covered, just like, as you said, with Medicare. Okay, and in this case, okay, you're in this country, you're covered.
Yeah.
And you don't have all that fighting to do. There's also a big change now during this pandemic. I want to bring up something on the screen that's different. Let me show you this graph. Here's a graph of newly confirmed COVID-19 cases per million people. And you'll see that, we had this huge spike, and then countries that have healthcare systems that really care about people, and it's not just socialized medicine, because United Kingdom has socialized medicine, and Canada, France, Australia, Italy, and others have some variations of it. But they all designed their healthcare system to meet people's health needs. You'll see in the upper right corner, we have a for-profit healthcare system in the United States that sees healthcare as just something to make money off of, and is run as a business for the benefits of business corporations, privately owned insurance companies, hospitals, pharmaceutical. And you'll see that the newly confirmed COVID-19 cases per million people are up in the United States because our system is designed so some corporations can make money, but it's not designed to meet people's health needs. I think this is a pretty compelling and a pretty damning indictment of what we have in this country now. And again, people in other countries would not tolerate that. But here, there's propaganda that tells people, oh no, if you do what Lynnette and Dr. Weinberg want, that's socialism. No, it's going to save lives. Anyway, so who can add to that? I just found that graph compelling. Who can add anything else to the insights?
I'll start out, but I know Sherry knows a lot about this. And the thing that I find humorous and frustrating is people want to throw this word socialized medicine like that's the worst thing ever. And, I have to think about, well, what about public schools? What about the fire department? What about the police department? And what we're talking about is a public-private concept, and that is you would still get your care from private people and the private hospitals, but it would be within the government that would actually work as the insurance company, negotiate contracts with different healthcare providers, and then pay out as the bills come in.
Yeah. And your examples you gave of things we have that are socialized, we have socialized libraries, and like you said, fire departments. If you have a fire at your house, you just call 911, and our socialized fire department will come out and take care of it. They don't say, well, wait a minute, you don't have to look in the phone book and get 3 vendors and say, I got a fire going on in my house. What would you charge to come out and put the thing out? And then they try and argue with you. Well, do you have pre-existing conditions? Did you leave oily rags in your garage? If so, we're not going to cover that, or we're going to charge you more, going to charge you a deductible because you were stupid and had oily rags in the garage, or you had a towel hanging over the burner on your kitchen stove, and if so, that's your fault, and we're not going to cover that. We don't have that. We have a fire department. They come out and they do it.
Well, we're about to run afoul of another example. In most countries, actually including ours, we put the government in charge of mail, the mail system. But somebody a while back decided that the post office system should pay for itself and sort of cut them loose, and they're supposed to charge enough to cover their costs. And it's not working very well. And there are people trying to undermine the post office to make them fail in hopes that then we'll have trouble with mail-in ballots in November.
Right. And this goes back to the George W. Bush era, when George W. Bush and Congress, the Republican Congress then, passed a law requiring the U.S. Postal Service to prepay health benefits for all of their employees 75 years ahead of time. No business could stay afloat if they had to prepay 75 years of health benefits for their employees ahead. But the idea was
especially at our healthcare costs in this country.
But they decided
Mexico for their healthcare.
Right, but they did that to try to bankrupt the U.S. Postal Service so that they could privatize it, and now we see that going on now. I want to cover an important concept that we've mentioned or alluded to. We need a universal healthcare system, and that's what we all, the 3 of us, want. A universal system, so everybody in, nobody out. And we see that slogan used a lot. And it's a practical solution. Make sure that every person has health care, and yet the Affordable Care Act, the ACA, fails to cover tens of millions of people. And even worse, Trump and the Republicans have been pushing hard to take away even that modest amount of health care from people. And if you look at the pandemic, here we have this contagious disease, and we have a lot of people who are deliberately excluded from having health care, which means they might have the disease and spread it to other people because they can't get their health care treated. And what a stupid way to run a pandemic is to have tens of millions of people who can't get the health care to cure themselves, so they're going around making everybody else contagious. Dr. Weinberg, can you explain the basic principle of universal, or maybe I've covered it already?
I think that there's a word that's needed here, and that is paradigm shift. We have to shift our thinking from healthcare as a business, of people selling healthcare to people who then buy it as consumers. Instead, healthcare should be looked at as part of our social infrastructure, like the fire, the police, the schools, etc., that it's a responsibility of us collectively to make sure it happens. And when something is a responsibility collectively, we choose to have our government do it, and we support the government with our taxes so they can do it. But it requires a shift in thinking, away from thinking of the healthcare system as a business and into thinking of it as something that we all own and take pride in and pay our taxes to support.
Right, and as a democracy, that really is more congruent with the concept of democracy rather than this other thing. When you and I are on the phone, Dr. Weinberg, to prepare for this, you mentioned that the first thing, the universal is a crucial point, bring everybody into the tent and then we can build an improved tent once we got everybody inside. So all ages, races, income levels, we're all in the same tent.
We bring everybody into the tent, and then together we can build a better tent.
Right,
And that together part is becoming more and more important as we deal with racial disparities and discrimination. That it isn't like bring everybody into the tent and then I will tell you what's a better tent. We all have to be in there together and build a better tent together.
Right. Yeah. We're a bit behind on our time frame. We've got a lot of good things to say. So I want to see if we can be kind of succinct. And we've touched on this next point as well already, but I want to drive it home. That another sensible, practical remedy that would solve a lot of problems would be to eliminate privately owned insurance companies that are owned by giant corporations and replace them with an efficient, streamlined public funding. And could one of you, we've talked about this already a bit, so could somebody kind of nail down some easy way for people to understand that?
Well, once you shift from the idea that it is the government's responsibility to make it happen, then you don't need the insurance companies any more than we need it for Medicare. You budget for it and you pay for it, and then you have it. And that's what the rest of the world does. Right.
Yeah, hundreds of years ago in this country, different people would start different fire departments, privately owned, hundreds of years ago. And that's why we still call these things, these units, organizational units, fire companies. It goes back to the old term from hundreds of years ago. And if your house catches fire, you have to contact the fire company that you have subscribed with, and they come out and do it. But people could figure out this is inefficient because, it would make more sense to have one fire department run by the city, and then no matter who you are or where you live, they'll go out and take care of it. And we need to make that change to our healthcare system that the people had the good sense to fix hundreds of years ago in the U.S. And we would also get better healthcare because you wouldn't have to spend a lot of time and effort arguing with them, trying to make them pay for things you've already prepaid for them to do. I want to follow up with a bit more in this line of thinking. Say, if we've laid out some reasons why universal single payer is the real solution to the problems, and how might it actually work? Dr. Weinberg, could you summarize how a universal single payer system could work in the U.S.?
Well, it's just look at Medicare. If it were improved, it needs to be improved because there are things that weren't important in 1965 when Medicare was founded that need to be in there. Things like vision, hearing, and prescription drugs need to be included. But just look at having the Department of Health and Human Services have a Medicare division, and they run the thing. Now, the United States is a very large country with 300 and umpty-ump million people, so you're probably not going to run it all out of one office in Washington, D.C., but you have one set of rules that apply everywhere, and you hire people. For instance, my Medicare is handled through an office in North Dakota, I think, but they just do what they're supposed to do.
Right. And then if you move from one state to another, you don't need to start from scratch and figure things out because now you're out of the network and you have to go shopping around again. So it's efficient in that way too. During the first half of this phone conversation here, video conversation, we identified problems and we're starting to look at solutions. Let's help the viewers further understand how universal single payer would actually solve the problems. And so, Dr. Weinberg, I want to ask you to start, and then Lynnette can follow with more insights. Why would this universal single payer actually accomplish? What would it accomplish in solving problems? How might we see differences, improvements in our healthcare system?
Well, we've already touched on some of them. The fact that you have complete choice of any licensed provider to provide your care within their scope of practice, and they have a deal with Medicare for how they're going to be paid and how much they're going to be paid. Medicare's administration would have the job of signing everybody up and of setting a fee schedule to pay for it. In the case of hospitals, it actually works best to put them on a global budget. Basically, you would start by saying, okay, hospital, how much did it cost you last year? Cost you to provide the care that you provided. Fine, we'll pay you that plus 5% for the first year, and we'll see how it goes. And then you adjust according to how much work the hospital actually has to do. And the other thing that you do this way is you control the building of new hospitals and new wings and acquiring all kinds of fancy technology. And you have some control over building it because it's needed and not building it because there are wealthy people living in Sammamish who will go to a new whiz-bang Swedish hospital out there.
Yeah. Decades ago, I knew a guy who had a professional position high up in state government. His job was to make sure that if a hospital says, or a clinic says, we want to buy this expensive piece of equipment, whatever, CAT scan or whatever, that there's actually a need for it, and they weren't going to be just spending money on redundant equipment that would not get used enough to pay for itself, where ordinary people get socked with additional costs to pay for, cover the cost for unused equipment. So there'd be some kind of rationality of figuring out what equipment do we really need. Let's not have redundant, unnecessary equipment that's not adequately used. Let's not have stuff that's wasteful when there's an efficient piece of equipment instead. So I can imagine those kinds of cost controls built into this as well.
Yeah, I can speak to that. I had an opportunity to live and work as a registered nurse in Norway. And it was interesting to watch how they take care of their people. Nobody went without. Everybody had very good care. In fact, I had my third baby over there, so I got to see what it's like to be a patient. And they did what you're talking about, a certificate of need. And that means, do we need another MRI? Do we need another CAT scan of some kind? Yeah. What they would do, they had it very well planned out. And that we were in Lillehammer, and there was and that's just north of Oslo. And they said, oh, that kind of care is the best down in Oslo. We're going to run you down there, and you're going to get good care there. And maybe another place about 25 miles away, they'd say, oh, they have a great rehab unit. We're going to go ahead and have your physical therapy done there. So it was very well mapped out. I felt very well taken care of.
Yeah. So it is possible to solve these problems. And I think what happens is people kind of throw up their hands and say, oh, this is just too screwy. Let's just keep going with the status quo. But the status quo is actually killing people. Yeah. We have, the U.S. has really, really bad life expectancy, infant mortality, unnecessary mortality from various kinds of things compared to other countries. We're not number one in healthcare outcomes. We're like, depending on what the indicator is, we're like 20th, 30th, 40th on the list. It's just really shameful. Let's see. Some people might be skeptical of universal single-payer healthcare for various reasons. One we mentioned already is socialism. Oh no, that's socialism. I'm afraid of that label. We can't do this because it might be socialist. And Lynnette, are there some other concerns that people might have that you can relieve their concerns?
Yes, I think one question I shared with you is sometimes we've got people out there that's saying, why should I help pay for someone else's health care? They should be paying for their own. And the odd thing is really the way that one should frame it is it's a human right to have health care. It's a moral situation, ethical situation. And also with our conservative people, our business people, they realize that this would really save them a lot of money that if we had universal health care.
Yeah.
So it should not be political. It's moral.
Right. Yeah. Years ago, I read that in other countries where the government takes care of the cost of health care, it's a governmental function. Here in the United States, where it's paid by, where businesses pay their employees health care, they have to cover that cost by jacking up the price of what they manufacture. So that makes things manufactured in the United States less competitive in the world market. So if you're buying a car, and I don't recall the numbers now, but years ago I read it's like $500 of the price of each car is to cover the healthcare costs. And if we had universal single payer, American-made cars would be cheaper, and that would be better, more competitive on the world market. And we don't think of that, but
Well,
we're actually. Go ahead.
right. It's not only that, but the auto industry that's centered in around Detroit figured it out and built plants across the bridge in Ontario, and they where their workers are provided with health care through the government, and that saves them a lot of money in the making of cars and provides a very nice living for the Canadian workers. But it undermines the livelihood of Detroit.
Yeah, so it caused poverty for the workers in the U.S. and Detroit that got laid off while they were hiring Canadians. And they also caused poverty to become a serious problem in Detroit that used to be a very prosperous city. So we can look at that as part of our healthcare crisis as well. And I know there's some other things. Lynnette, you had sent me a list of 13 different tough questions, and we don't have time to get into these, but these things, there are remedies for these things. How do you pay for it? Well, there's different ways of doing taxes, and there's different this and that. And there's a lot of savings, so that we actually, for years, I've been seeing data showing that if we covered everybody with this efficient universal healthcare system, single payer, we could afford to cover the people who have no health care now, and it won't cost us any more. We're just reallocating where the money goes.
It can actually, depending on who's doing the figures, we could actually save money. It would probably cost a little bit more at the beginning while we're getting the new system up and running.
Yeah.
But once it's going, the big thing that would be flattened would be the increase in cost.
Yeah.
The inflation of healthcare costs would be tamped right down.
Right, because when Obama was promoting his Affordable Care Act, they wrote into that law a prohibition against negotiating with pharmaceutical companies to keep the costs down. And we need to do that negotiation and keep the costs down, because a part of pharmaceutical companies are just making off like bandits. And there's no reason other than political corruption why the politicians do not want to negotiate for lower prices with big pharma. I want to move on here.
They are paying an awful lot of money to our elected representatives and senators to fund their campaigns with the unspoken, I think, promise that when they get there, they'll see to it that we don't go to Medicare for all because we won't cut them out.
Right. That's been happening for quite a while, and it still is happening. And I won't mention any names, but there are some names that we know from our region. Public opinion polling shows that if they just ask the American people about what kind of healthcare system you want, people actually would want this, as long as they don't attach the name socialist to it. But people want everybody covered. They want high quality healthcare. They want to control the costs, and they want efficiency instead of fighting with insurance companies. And this is true for people across the political spectrum. It's also true of doctors and nurses. So we have a very prominent nurse. Lynnette, you're the president of the Washington State Nurses Association.
Yes, that's right.
And you're on board with this. And Dr. Weinberg.
So is the association. There's been a resolution that was brought up and voted on in 2017 that said, yes, we need to bring in universal health care.
Right. And the National Nurses Association is one of the strong proponents of this as well. Dr. Weinberg, you're a doctor. You work with other doctors, and you're part of this organization, Physicians for a National Health Program. I've had people from that organization as guests on my program years ago.
We're still, if you poll doctors, it's now over 50% of physicians who support the idea that we need to go to a national single payer system.
Yeah.
It depends on how you ask the question, of course.
Yeah.
If you say, do you want socialized medicine, then they don't. But if you say, do you think it's a government responsibility to provide health care for everybody, and would you support a system that does that, then they say yes, a majority. It's hard to get organized medicine to do it, so I'm also a member of and a delegate in the Washington State Medical Association, which has a minority that are strong single-payer people. And they also have a small minority who say, oh, take the insurance companies away and just pay me in chickens and eggs. And then everybody else says, I got to go see my patients. So it's hard to really get them to come to grips with it. But it's becoming a little looser.
Yeah. Just a couple of years ago, I was at the state capitol here in Olympia, talking with people about this, and one person I met was the young woman. She's the wife of a young doctor, and he, of course, was interested in practicing medicine, but he was just dreading the notion of having to deal with insurance companies, and he wanted to have some kind of an alternative. He and his wife are both supporting what we're talking about here, but he wanted to have some kind of a medical practice where he would not have to fight with insurance companies. He just wants to practice really good medicine and serve the patients. So I want to move on here. Let's see. There's something interesting in U.S. history. For a very long time, there have been things that have been national problems that Congress doesn't want to deal with. But some state will figure out, oh, here's a remedy. Let's try this here at the state level. And then some other state will say, oh, well, here, yeah, let's do this. And then after a few states have done this, then the national level Congress or the executive branch will say, well, let's go ahead and do this nationally. And we know in Canada, which has a good healthcare system, Saskatchewan was the first province to do it. And it worked so wonderfully that all the other provinces wanted to do it too, and it became a national system. And this was decades ago in Canada. And we need to do that here.
Well, Canada actually still has individual provincial plans with an overarching federal some funding and some standard setting to make sure that everybody is covered. So the provincial plans can't leave anybody out. But they are individually done, and they have individually different taxation methods within the different provinces. And what's really coming up now in Canada, they've had very different handling of the need for prescription pharmaceuticals, because similar to Medicare, when Canada's system was developing, pharmaceuticals were not a big deal in terms of overall costs, and they weren't included. So they're working on including pharmaceuticals now.
Yeah. So we need to figure out which state here is going to be the Saskatchewan for the United States,
right?
Where we do it, and then everybody says, "Oh, Washington State did this. Let's copy Washington State," and the thing can sweep the nation. And we're a bit behind on the time, but I just want to mention that all three of us are active in the statewide organization, Healthcare for All Washington, and you folks have had leadership roles there. And then there's also a new state government entity called Universal Healthcare Work Group that both of you are very active in. And so that's something. But people can get more information. I'll have the information on my blog so people can find out what's happening. We talked already about big money in politics, how that corrupts not just this, but every system you work for. If you want to work on food safety, well, there are big corporations that don't want food to be safe because they're making money the way it is, and they fund the politicians. And there are politicians that are funded by the weapon manufacturers that make nuclear weapons and bomber planes and submarines and stuff. And every issue, and one of the TV programs they did some years ago about the problems with big money in election campaigns, one of my guests said, whatever your issue is that you're working on, like abolishing nuclear weapons or healthcare or whatever, climate, you have to have getting big money out of politics tied for first place as your issue, because we're not going to make progress on the climate crisis. We're not going to make progress on abolishing nuclear weapons, on getting healthcare for everybody, until we get the big money out of politics. So I just want to lift that up. And it's corrupting everything that goes on in this country, and we really have to get onto that. I do want to encourage our viewers to connect with the organization that we're all a part of. The Universal Single Payer Solution really does make sense. There's a huge amount of expertise here in Washington State, and our statewide organization, Healthcare for All Washington, does good work. Their website will provide at the end, as in the resources at the end of this interview. It's healthcareforallwa.org. So healthcareforallwa.org. The phone is 707-742-3292, and we'll have that listed at the end as well. And it really is a statewide organization. All three of us here are from different parts of the state, and we have members all over. And we really need this bold solution, and we have to overcome the obstacles, the political obstacles and other kinds of things, so we can move to this remedy. Would any of you offer anything briefly about how to build a movement to achieve this?
Well, I'd like to mention also, just spinning off the two of you, is, we're talking about Washington State, and maybe we'll be the first one. I wouldn't be surprised. There's also Oregon, California,
Colorado made progress. Vermont was considering it.
Yeah, there's a lot of us out there that are working on this. So actually, Healthcare for All is also a national group.
Yes.
So we are coordinating together so we don't have to all invent the wheel.
Right.
So I think Washington State may very well. We talked briefly that Sherry and I are in this Washington State Universal Healthcare Work Group. And we were allocated funds by the last session in 2019 of about $500,000. So they're serious here in the legislature of trying to get this done.
Right, and I'll provide a few links at the end of this interview and more links on my blog. It'll be a lot of information on the blog post, and I'll tell you at the end how to get that. A lot of excellent sources of information exist. There are a lot of books, articles, videos, nonprofit organization. I don't have time to mention them right now, but we'll list them at the end. And again, my blog has a healthcare reform category, and you can visit parallaxperspectives.org and then click the healthcare reform part. And Parallax is spelled with one R and two L's, PARALLAX, perspectives.org, and then click healthcare reform. And then you can also at that link see the oldest post on that category of the blog is the interview with Dr. Weinberg from December 2015. Lots of organizations and videos. There's a fun video to watch. It's only 7 minutes long, but it has people from different countries around the world expressing alarm at how stupid Trump has been in failing to deal with the coronavirus and how dysfunctional our healthcare system is. It's just an amazing 7-minute video, and I'll have a link to that on my blog. We really do need to make progress on this, and it's got to come from the grassroots up. It will not come as a gift from Congress. It will not come as a gift from the state legislature or any governor. We have to push them to make this happen, and as folks like Lynnette and Dr. Weinberg and me and some of the people watching this program, we're going to make this happen. So I want to thank Lynnette and Dr. Weinberg for sharing their extensive knowledge and their smart insights during this interview. I want to thank the people who've been watching. We have had our current healthcare system for so long that people find it hard to imagine something different. It's very much entrenched. We have powerful political and economic forces that keep it entrenched and try to prevent people from asking the kind of difficult questions that we've been trying to raise during this hour. Say, hey, there's a better way, there's a better way. And we need to cover everybody with high quality, save money and we can save lives. And there's going to be more information on the blog beyond what we had time to say during this hour. But it really is important, especially now with the coronavirus pandemic, where so many millions of people really, really desperately need this. So now is the time to push. And I urge people to connect with Healthcare for All Washington and look at what's on my blog, parallaxperspectives.org, and tell your friends about this. Invite your friends to watch the TV program through the blog or through Thurston Community Media for people in Thurston County, Washington who have cable, Channel 22, Mondays at 1:30 p.m., Wednesdays at 5 p.m., and Thursdays at 9 p.m. And people can get information about a wide variety of other issues related to peace, social justice, and nonviolence through my blog, or you can phone me at 360-491-9093. We are all one human family. We all share one planet. We can create a better world, but we all have to work at it, and the world needs exactly what you all have to offer. So thanks to Lynnette and Dr. Weinberg, and thanks to all the folks out there that are helping to turn things around. Thank you.
Thank you. Thank you.
Thank you. Thank you.
Okay.